Hello, everyone. I believe we are live. I am here with Dr. Natasha Hayden, a Montreal chiropractor. And today we're talking about a juicy topic. When to see your chiro during pregnancy, postpartum, and when your kids, babies even, can be treated. That was one question I had for Natasha. So that's what we're talking about today. And it's a super important topic because a lot of times doctors are not necessarily aware of all the alternative care that is offered. And I don't know if, Natasha, you can correct me. Perhaps you don't like to be called alternative healthcare. But as doulas, our group of doulas, we refer our clients to chiropractors, acupuncturists, homeopaths, a lot of different type of care. And we notice that our clients' doctors don't always do that. Some of them do. Some of them are great about it, but not everybody does. So if you have questions about this and you're watching us live today, please put them in the comments. Have you been to a chiro? Has your chiro helped you? I must say I did not go to a chiropractor when I was pregnant. I didn't have one then, but I wish I did because I did suffer from sciatica, like many of you. So, Dr. Hayden, Natasha, I'm going to call you. Welcome. I'm so
Thanks
happy
for having
you're here.
me. Yeah. Just to touch on, I guess, a paramedical or alternative, I like the term physical medicine because I find that creates a really nice distinction between the internal medicine that we do tend to seek with our traditional or medical doctors, GPs, and more of a body-focused or mobility-focused approach to healthcare.
So nice. Good.
Mm-hmm.
So what did you say? Physical
medicine.
Physical medicine. I have a chiro now, and I could not live without her care. She helped me. As a doula, we get into these funky positions sometimes, and my back was going out, and after birth, going and getting a treatment has helped me tremendously. Well, welcome. Absolutely. You've been a chiropractor for about 8 years now.
Yeah, time flies.
And you have a clinic in Montreal here.
Yeah, and it really between NDG, Côte des Neiges, Westmount, Côte Saint Luc, we're kind of in a funny little area, Hampstead. We border really all of those neighborhoods, so we're pretty accessible. Yeah.
And one of your clientele, which is why we got you here, is pregnant women, and we're going to talk about a technique that some chiros, not all of them, use. And you've studied this technique. It's called the Webster Technique.
Yeah,
and
that's right.
That's going to be part of what we're talking about today. So let's jump right in about pregnancy. I had a client once, a few years back, and she went to the doctor. She had 3 months left to go in her pregnancy and was suffering with sciatica, and she could no longer walk hardly. So she went to see her doctor, and her doctor's response was, it's just one of those pregnancy symptoms. You'll just have to tough it out for another 3 months until baby is born. Well, she called me because she had a doula. And I said, no. 3 months is a long time. Let's not wait. And I gave her the name of a chiro. She went for 1 or 2 sessions, and her sciatica was greatly relieved, did not come back. And I'm assuming you see this quite often in your practice.
Yeah, I don't think I really meant to start or to set out to be a pregnancy chiropractor, but my patients started to get pregnant, and they would come in, and especially if it was a second or a third pregnancy, we'd adjust them, and they just say, wow, I didn't know I could feel this good while I was pregnant. Like they had no idea, and they were sleeping better than they had in previous pregnancies, and they're able to stay active longer, maybe not at their normal pace, but like we have a woman now, she's right in the last few weeks, and she's still swimming and she's feeling really great. So then that's when I decided to seek out the Webster certification, because I knew that was really widely recognized, and then we could work more with local doulas or birth care providers.
Yes, as in my doula team with Mika and Ida, We send our clients often, particularly ones who have the Webster Technique, but for all different types of symptoms. So I thought maybe, when should we be going? If we're pregnant, when should we be seeing a chiro? When should they call you?
Yeah. Honestly, you can call preconception if you've had some postural concerns or you tend to have some achy, sore joints from time to time. We can always just get you started with a postural consult. And if there's anything that we want to address, like as you're preparing to get pregnant or during that phase, we can start there for sure.
Yeah.
The biggest take home I really like to say is you don't have to wait till you're in pain. I guess that's just what a lot of us are used to, but our bodies usually start asking very gently when they'd like to be moving better before they start screaming at us. So, if you have that joint that just feels a little tight or achy before pregnancy or during, if you can't get into a full deep squat without your heels lifting off the floor, that's a big one. That means you really need to improve those pelvic biomechanics so you're prepared to be pregnant and then labor later on. So
Okay.
the deep squat is really going to be the biggest one you can check. But yeah, posture is huge in pregnancy.
Yeah. Oh, definitely. And especially as the bellies get bigger, right? It just keep growing and growing and growing.
Yeah.
And now with clients it's winter time, and the way we walk
Ice.
and hold ourselves because we're so worried about falling. And
Absolutely.
the hormone relaxin is in your body like mad, right? The levels are very, very high, and they make us lose it. It doesn't allow us to have the same balance as when, pre-pregnancy, for sure.
Yeah. Well, your center of gravity actually shifts as that your belly begins to grow. So it's really important to make sure that we're adjusting and accommodating our posture accordingly. And the relaxin that you mentioned, that can actually stay on for several months after you give birth.
Really? I did not know.
They're starting to see that. I can't remember if it was 6 months but they're seeing it can hang on for a while even after you deliver.
Wow.
And that's a good thing. We want that. We want our bodies to be able to open up and give birth, but it can come with just with joints that are looser, then you're going to be more prone to certain conditions.
Right. So besides the sciatica that I mentioned before, you listed when we did our prep talk a whole bunch of symptoms that people can see you for. Why don't you name some of them? I didn't think of all of them.
So probably the one that would be unique to pregnancy would be round ligament pain, because the ligaments, as they're changing and the uterus is the way it's suspended in the pelvic cavity, you can have round ligament pain.
Where is that, Natasha? That's in your hips?
Just above the front of the hips, really.
Okay.
Yeah. The front of the
pelvis. As
pelvis,
the belly gets bigger, that right where the pelvis is, for sure.
And those ligaments are stretching and thickening, and we can have some round ligament pain.
Okay.
But other than that, really what we're seeing is certain conditions that anyone could have that are more prevalent in pregnancy as the joints start to relax. So you have neck pain, headaches, upper back or shoulder pain, carpal tunnel, could have some rib pain, different issues like that, leg pain, you mentioned sciatica, low back pain. Those are some of the more common conditions that we'll see.
And so many of you out there listening, I know you have all of them. Maybe not all of them. I hope you don't have all of them. But I know sore back, sore neck, sore hips, the carpal tunnel. Oh my gosh, even in pregnancy. That's something we see often in postpartum, but in pregnancy. And our message to you today is just, you don't have to suffer. There are treatments for these, and to seek help so that you're living, so that you're not bogged down by all of the symptoms, right? Pregnancy is such a beautiful time, but it often can be a not so beautiful time for many because of all of the physical ailments.
Yeah, absolutely.
Do chiropractors help at all with, I would say, reflux or heartburn? Is that something that they would touch upon? It is physical, but perhaps not in the same way.
Not in the same way. One of the things we sometimes see people say is they're sleeping better, or some people feel a little less anxious when their bodies are moving better. So there's some kind of self-reported cases where people find that those symptoms are less when they're being adjusted regularly. But as it is now, we don't really have a good mechanism to explain that.
Right.
So if it's a happy accident that we're adjusting you and those things are less or going away,
The bonus.
then that's
a bonus.
Yeah, that's great. That's a happy bonus, but it's definitely not something we're promoting necessarily, because we don't really have a good explanation for why those things happen.
Right.
Yeah. Because in non-pregnant women, sometimes we see decreased PMS symptoms, like especially if low back pain is a part of that for them. But again, it's a happy coincidence is usually what we call
We'll
that.
take it. We'll take
Absolutely.
Right?
That's a very good side effect, I would say.
Yeah. Now, one of the reasons we send our clients to chiropractors is when their babies are presenting breech. So usually babies, we want them to be head down by a certain time in their pregnancy, later on, third trimester. And then, even late third trimester, but sometimes babies are not head down. Now, we talked about, chiros can help turn babies. And then we'd like to say that, no, chiros do not help actually turn the baby.
No,
right?
that's obstetrics. Yeah.
That's right.
Yeah.
That is obstetrics. So what do you do with your Webster technique that helps clients? Why are we sending them to you at this point?
Okay. Webster Technique is a sacral analysis. So that's the last bone at the end of your spine. It's a really gentle technique to help improve the movement. And in pregnancy in particular, because we have a lot of ligaments attaching to the sacrum, the idea is as we improve pelvic motion and we also do a lot of work on the ligaments as well that are attaching to the uterus, to the pelvis, that we can allow room or space for baby to position themselves optimally. The example I like for that, or the analogy I like, is say you're in bed and you're cozy in your sheets and someone sits right on the edge. It's kind of hard to move around in there after that. So if we're able to get that person off the bed or loosen up,
Take them off.
get that sacrum position better and work and loosen some of those ligaments, and then also get you into feeling comfortable to get back into good activity and sleeping better. We create these optimal biomechanics so that baby will find themselves in that position we want them for birth.
Okay, so making more room in the woman's body to enable the baby to turn.
Absolutely.
Now, do you have stats on that? I know in certain, say with acupuncture or say an external turn, an external version, there's about 50% success
Risks are
rate.
pretty high with that too. Potential complications is that external cephalic, I think they call that term.
Yes, yeah, the ECD, yeah.
I don't think there's high quality level of stats, but kind of within the community or from what the tracking that does happen from Webster certified docs is I think they tend to see over 90%.
Really?
I've had mentors where the few that didn't end up positioning themselves, it was really because someone came in right at the 11th hour. And so there wasn't much kind of time to work with the pelvis. But most of my colleagues that have been doing this for a while, they see really good results.
Nice. That's an important point is when should they come and see you if baby is breech? What week? When should they start?
I guess really when either your midwife or your doctor's concerned about baby's position will be a good time to come in. There's not really a specific week that we recommend because we really feel that chiropractic is an important care of your birth care team.
Yes.
Absolutely.
Right.
But that being said, we've had women come in and they get that one adjustment just before because they didn't know it was an option, and we're happy to see you if that's the case. And they're usually really happy to have had that done and just make sure everything is open and moving well before they head into labor. So but for positioning, ideally we would work with you maybe even second trimester or beginning of the third, just to start creating that space so that when baby's supposed to go ahead and flip around and stay put, they have that space. So not in full panic mode.
A lot of people call us in panic and in our classes saying, oh my gosh, I'm 30 weeks and baby's not head down yet. Well, at 30 weeks, even 32 weeks, 33, it's technically still not a breech position. And I say, don't worry about it. You still have lots of time to be turning baby. However, we can be getting those adjustments done in preparation of birth anyway, really, loosen all of the ligaments, and
Yeah.
hopefully that will help turn baby. Now let's talk about after baby comes. Moms and parents are so busy during this time that sometimes the physical side of things after you give birth, I mean, I'll share my personal story. I did feel like a truck had run over me. It was,
Yeah.
you use every single muscle in your body.
Mhm.
And I wish at that time that I had seen someone, a massage therapist or a chiro, just to get me
Absolutely.
back. But there are certain things I find in my clientele related to hours and hours of breastfeeding in the postpartum,
Absolutely.
right?
Mhm.
Like sore neck, shoulders, back, I would
Mhm.
imagine.
Yeah, headaches sometimes, and yeah, really
Mhm.
postural because you find yourself you're holding
Oh,
baby
you're
and
hunched,
yeah,
down, trying to get the nipple in the
yeah,
baby's mouth, right? And it's
yeah,
not working. Or it is
yeah, or
working, but you're doing it for hours.
yeah, even if you've got a doula you're working with or a lactation consultant and that's going well, they're so cute. You just want to bend forward and really stare at them, right?
For hours and hours.
Yeah, hours
Yes,
and
yes,
hours,
yeah.
or like changing tables and just picking them up, and they just keep getting
Mhm.
bigger, right?
Heavier. Well,
Yeah.
I suffered a lot with the carpal tunnel
Okay.
in my wrists after every baby. I have three of them, three.
Yeah.
And it's, as you know, your wrists are always
Mm.
kind of not
Mhm.
broken, but in that broken position. They're not
Yeah.
straight. And just with
Very
the
flexed.
baby's growing 7 pounds,
Mhm.
8 pounds, 9 pounds. I had great biceps, but the carpal tunnel killed me. People have to
Mhm.
get braces for them. Like you must see that.
Yeah. Absolutely. Yeah. So if you're feeling uncomfortable with breastfeeding, like you don't just know you don't have to put up with an achy back or neck or
Mm.
headaches because you're doing that. Sometimes we might even just help you find some more comfortable positions you can breastfeed in addition to mobilizing that spine and just get it moving again. So you can, you're not cranky, so cranky.
Yeah. Well, I think the number
Yeah.
one challenge, and comment if you're watching, and what's your number one challenge after you had a baby is the time, right? You've got
Hmm.
this newborn, you're sore, but I just didn't take the time or make the time to take care
Hmm.
of me, basically, because we're on this learning
Absolutely.
curve. Now, chiro treatments are how long? How long are they?
In my office, they're about 15 minutes. They might be a
So
bit
it's
longer
not
with
like a
a
1 hour massage where
absolutely.
we're relieving baby for 1 hour.
Hmm. Hmm.
Can they bring baby to see you, with you, or
Yeah,
with them?
absolutely. Yeah. Some parents, that's their time and they don't want to come with baby, but they're always welcome to come at a visit. If that's how it is for them to get out of the house, it's totally fine.
Yeah,
Um, Absolutely. Hmm.
yeah, I think so. And I always say, as postpartum doulas, sometimes we do accompany our clients, to the chiro or to the
Yeah.
massage place, and hang out with them just while they get treated.
Hmm.
And you were sharing a story that sometimes you'll have a baby crying in your office, and
Yeah.
you'll stop the treatment, address baby situation, and then
Hmm.
continue. So,
Yeah.
a baby friendly clinic.
Yeah, absolutely. Because
Now,
it's gonna
talk.
be hard to get out.
It is hard to get out, definitely. I remember that, and if you've got two babies and whatnot, it's sometimes
Hmm.
almost impossible for a while.
Yep. Sometimes the whole family comes in. That's totally
There
fine.
you go.
Yeah. If they're older, they'll probably just color or they're pretty good. Sometimes they have lots of questions. They're
Yeah, I
usually,
brought all three of my
yeah.
kids to my chiro, and they were all there
Good.
watching me get treated and having a
Yeah.
great chat with my chiro.
Yeah.
Uh,
Absolutely.
Speaking of babies,
Hmm.
I did not know at what age babies could be treated, and you said
Hmm.
they can come in at any time when they're new,
Hmm.
fresh.
Yeah.
You said they
Yeah.
were
I
when
said
they're
when they were
fresh.
fresh. Yeah. Well, yeah, exactly. Yeah, so it really depends. I mean, if you had a labor that maybe was really difficult or there was some trouble there, then we're really just looking at symmetry with babies and younger kids. So sometimes like gluteal fold or those little butt cheeks, if they're not really lined up, then that could
Yeah.
mean the pelvis could be moving a bit better. Or if you notice they're always kind of holding their head in a certain position. I see this in baby photos all the time on social. Their head's always pointed one way, preferring one breast over the other. We actually had a pretty good study just come out on colic. So I think they call that
Mm,
colic without explanation, where they know it's not like
okay.
a reflux or anything digestive going on. And I think they tell you just have to let it pass. We had a pretty good study that just came out, and those babies will respond really well to chiropractic care.
Nice.
Yeah.
Yeah. Yeah, yeah. And I've seen clients with babies that, sometimes I guess just perhaps all the work that they do coming out of the birth canal, you know, can get a little bit sore on one side, and then they prefer feeding to the one to one side. But what happens is that they're not just feeding that way, they're actually always sleeping in that same position, and then you start getting flat face syndrome, or a flat, you know, the flat face when they're to the side. So it's important to be watching that, not being obsessed about it, but if you notice maybe it's always on the one side.
Or if you have like a uneven, like bald spots, or, you know, from being in the carrier, because their heads always turn one way, so their hair's starting to wear a little more on one side, that can be a good sign too, that they're not feeling so comfortable, or something's not really lined up the way that we want.
So the whole family, it's a care that a whole family can benefit from.
Absolutely.
Oh, wonderful. Wonderful. Well, I am so happy that we chatted about this. What would be your, you know, tips and tools that you can leave moms with today?
Don't wait. If you're feeling uncomfortable, like find, whether it's chiropractic, massage, acupuncture, find someone that can help you be moving and feeling better in your body. And then especially too, like once you have baby, make that time for yourself, you know, like you can't pour from an empty cup. So whether it's a 15-minute chiropractic appointment, or even if it's just, you know, you can trade childcare and step out for like a walk, or get that little exercise in,
get moving.
Absolutely. Yeah. I often say, like, to moms when their kids are a bit older, have a dance party. You know,
we do.
Yeah. Right. Kids love that. So you can usually find a way that the whole family can move and just feel more comfortable. And yeah, definitely, like I really love prenatal yoga or prenatal Pilates, just finding something that you enjoy. And ideally we start to kind of get into or build that routine before we're pregnant, but just finding something that resonates with you, so that you're moving and you're feeling comfortable, and then really able to pass those habits on as your kids begin to grow. It's really, our bodies are made
It is in anything, right? We're just if we're not feeling well, we just can't take care of other people.
Absolutely.
And as new moms, we're taking care of everybody else, aren't we?
But yourself often. Absolutely.
Except ourselves, I know. And I was guilty.
Yeah.
I think
I sometimes joke, I'll write you a note, you can go away for a weekend.
Can you write me one? Can you write me one, Natasha? I want to go away.
Happy to do that. I'll write to you. Your partner can take care of your kids, and you leave for a weekend.
Thank you. Well, thank you so much, Natasha, for being here. If you have questions, if you're watching this in the replay, please post them. Natasha and I will monitor the feed, and she will answer any questions that you have.
Absolutely.
She's also going to put a link to her clinic in the comments as well. If you do need some help, whether that be in pregnancy, pre-pregnancy, pregnancy, postpartum, go and book an appointment with her. She's lovely, and she'll get you feeling better in no time. And join us for our next Doula Dialogue. The next Doula Dialogue is the 31st. Next week, Friday, I will be speaking with my colleague and co-doula, Jenny B. And we are going to be delving into the world of pumping breast milk.
Yeah.
To be clear. So join us then. Again, thank you so much for listening, and we'll catch you next time on the Doula Dialogues. Bye, Natasha.
Bye. Thank you.